Hello, my name's Chrissy Lawson and I'm the administrator within the Transplant team here at Royal Papworth Hospital. I'm here with my colleague Katie Archer, Sarah Claydon and Bianca Lord, and we've come together to put together a team of link nurses to help you guys at home write to your donor family should you wish to. We formed the team last year, and since we have formed the team, we've noticed a marked increase in letter writing, so that's fantastic news. We've also put some changes in place to improve the service, but we still get quite a lot of questions about what we should write and what to do, how to go about writing to your donor family. So we're going to try and answer some of those questions now. So, Katie, when should the people at home write to their donor family?
So we usually recommend that people wait about 6 months after their transplant to receive their donor details and to write a letter. The reason being is that you're still recovering from major surgery, but also that family that you're writing to is still grieving.
So how would people at home go about getting their donor details?
So people can come and speak to us in clinic. You can speak to myself, Sarah or Bianca, and we can give you your details in clinic. Or because a lot of consultations are being done via the phone at the moment, you can always give us a ring and we can talk over the phone with you. Now, the details we will give you is a rough age and also a gender. The reason we give you these details is the intention of writing a letter, so that you know who you're writing to. If it's somebody who's particularly younger, it could be to children, or it could be to siblings, or if it's someone older, it could be to spouse, partner, or potentially other family members.
So Bianca, what should patients include in their letters?
So there should be a letter of thanks for the gift that you've received for your transplant. It should also include how transplant has changed your life, including also what you can do now compared to what you couldn't do before. So that, for example, sports or playing with your grandchildren, just an example like that would be good.
So on the flip side of that, what do you advise that they don't include in the letter?
So the letter needs to be anonymised. If it's your first letter, you should really just include your first name, so non-identifiable information like your address or your surname, your phone number or your email address. It should also not include anything about Royal Papworth Hospital. And complications tend to come up quite frequently in these letters, so do not mention sort of any side effects of your medication or complications you may have had from your transplant. And it needs to be sort of quite a positive letter.
So what happens to the letters when they reach Papworth Hospital?
So it comes to one of us, Katie, Sarah or Chrissy actually, and myself. We check it, so we screen it to make sure that the content is okay, and then it gets sent to the specialist nurses in organ donation, who also check this letter. So how long it can take from when we send it to how long it's received by the family, we don't know that. So it does get screened first prior to being sent to the donor family if appropriate.
So Sarah, do I get told if my donor family received my letter?
So no, we don't get told if the donor family received the letter. The only time we ever receive communication from the specialist nurses is if for some reason the donor family have chosen not to receive that letter and have asked for it to be sent back. There can be a multitude of reasons that somebody may not want to receive a letter. Sometimes it can be because it's too painful or too early for them to have it at that time. We'll ring you if that happens and we'll explain it to you. It doesn't mean that you can't write to them again in the future, but it perhaps just means at that time they don't want to necessarily receive that letter. Sometimes families do ask the specialist nurses to keep the letters on file. Again, we won't be told about that. It just gives the family the option that if, say, in a few weeks they've had time to process that letter being received, they can then ask for it and receive it at that time.
Okay, so following on from that, if my donor family don't write back, can I write it to them again?
Yes, so we've had some people who've written quite a few times before perhaps the donor family has written back. Sometimes a good time to write is on the anniversary of your transplant and what would have been that donor's date of death. Sometimes the first few letters can be difficult for that family to think about what they're going to write, and just having that elongated period of time can give them the confidence to feel that they can then write back.
Can I ever make contact with my donor family?
So we recommend that, initially write your first letter. Some donor families will be very quick at writing back. Once you've corresponded a few times, the question often does come up about can I meet or meeting in person. It's not something that we regularly have happen, particularly obviously at the moment with the restrictions in meeting, but we have facilitated a few people meeting with their donor families. This meeting is recommended to happen in a neutral place, with a member of the transplant team or a member of the specialist nurses team present. And the only reason for this is obviously it's a very difficult meeting. It's not something that necessarily people know how they're going to react until they're put in that position. So having a member of the team there who can just act as someone in between for you to just talk to and for the family to talk to can just help assist that. After that point, if the meeting goes successfully and you want to carry on having contact, that's absolutely fine, and that can be facilitated, and you can then carry on communicating without us being in between. But I have to say that has to be a long period of time, and you must have had multiple episodes of communication prior to meeting.
That's lovely. I think that's all the questions. So thank you very much.
Thank you.